Hello, my name is Jacqueline Barry, and I am a senior occupational therapy student. The title of my capstone is The Missing Link, Medication Management and Occupational Performance. First, I'm going to share with you what an occupational therapist does. An occupational therapist, or OT, helps people across the lifespan, or as we like to say, we work with people from womb to tomb, with things that they need or want to do. Common locations for OTs to work at are in schools and rehab facilities. In schools, OTs can help children to be able to participate in all of their school activities. For example, the photo on the left shows an OT working with a student on fine motor skills. For example, an OT can work with a child on their motor skills so they have the ability to grasp and write with a pencil. Setting, OTs can help people regain the skills that they might have lost after an injury, and this goes for both physical and cognitive changes that may occur. For example, the photo on the right shows an occupational therapist teaching a client how to get into a tub after hip surgery. There are 8 areas of occupation that each person participates in. Those occupations are activities of daily living, instrumental activities of daily living, education, work, play, leisure, social participation, and rest and sleep. I am now going to introduce to you the Occupational Therapy Practice Framework. This is considered our Bible. I even have the framework printed out and laminated, and one day, one of my professors saw it, and she was like, "What is this? Can you make one for me?" If we were able to be here in person today, I would have shown you all. This document outlines what occupational therapy can do during their practice. The reason for this is to allow healthcare professionals to differentiate from one another. For example, what can an occupational therapist bring to the table that is different from a physical therapist? And this is important because I'm going to bring it up later in our presentation. So, in junior year, I was asked to write an occupational performance paper for my older adult class. We were able to pick any topic that we had learned about, and we had to write a 5-page paper on it. Here is all of the topics that I had to choose from. I had chosen medication management. On the right, you can see the criteria that we had to write for the paper. We had to write the relevance to occupational therapy's role, risk and protective factors, best practice, assistive technology that could help, legislative, political, or social issues. Now, don't worry, I'm not going to read you my entire paper, but I am going to tell you a story about it. So I went right to our framework, or as I called it before, the OT Bible, and I looked at performance patterns. Every individual has 4 performance patterns. Those are habits, routines, rituals, and roles. Within the practice framework, it states that occupational therapists can help clients establish routines. I want you to think about your morning routine. And if you take any medication, do you take medication on an empty stomach? Or maybe before breakfast? Do you keep your medication somewhere that reminds you to take it, such as a nightstand or in the bathroom next to your toothbrush, or maybe even in the kitchen? Medications are usually taken within an individual's routine, such as before or after a meal or at a certain time of the day, such as before a person goes to bed. This is one of occupational therapy's distinctive roles within medication management. If you answered yes to my question, if you take medication, you'll know that there are many steps that are involved within medication management. Those steps include filling the prescription, understanding how to take the prescription, taking the medication safely, monitoring the medication, and refilling the prescription. And this all repeats. There are many personal factors that can affect medication management, such as fine motor skills, vision, cognitive, health literacy, and numeracy. An occupational therapist evaluates and assesses how the client performs these steps. The occupational therapist can then give interventions to help optimize these personal factors so they do not interfere with a client's medicational management. An occupational therapist uses their knowledge to help remediate those skills or create modifications if those skills cannot be restored. These personal factors are considered performance skills, and they fall under the motor and process skills. I have now introduced you to two different parts of the occupational therapy practice framework, but so far, the parts have not specifically mentioned medication management, but there are two parts of the framework that do. One of them lists that medication management is a part of instrumental activities of daily living, which is an area of occupation that I mentioned earlier, and it falls under the category of health maintenance and management. As you can see, under health management and maintenance, developing, managing, and maintaining routines for health and wellness promotion, such as physical fitness, nutrition, decreased health risk behaviors, and medication routines are a part of occupational therapy's practice. The next place that it is mentioned is within the types of intervention. There are 8 types of interventions. Those are occupations, activities, preparatory methods, preparatory tasks, education, training, advocacy, and group interventions. And within training, the framework states that OTs can help clients manage activities and medications through the use of assistive devices. Ever wonder what some medication management devices look like? Well, I'm sure that you have all heard of pill boxes, but they have pill boxes out there that will dispense medication at a certain time. They have ones that will vibrate to remind you to take your medication. They have ones that will flash. They even have some that will contact a family member if you do not take your medication at a certain time. As an occupational therapist, we would teach you how to use your new device to make sure that you are comfortable with it. I am now going to show you a video of how an electronic pill box or dispenser works.
Congratulations on your decision to make the MedQ your first line of defense to ensure your good health and well-being. With MedQ's simple design and operation, it is virtually impossible for you to double dose or forget your pills. MedQ has been designed to be simple to use and easy to operate. Oversized buttons for easy programming. Large, easy-to-read numbers. Easily seen reminders tell you when your next alert is due. MedQ even tells you when your batteries are low. You can program your MedQ for any time, day or night. You can set your reminder for twice a day for 1 week or once a day for 2 weeks. Your choice. When it's time to take your pills, MedQ will notify you with a flashing light in the individual pill box that needs to be taken. An alarm will sound as well. The alarm starts soft and grows louder for 5 minutes and then shuts off. The alarm will repeat its cycle every 25 minutes until you have taken your pills. Simply press the Next Alert button and the alarm will stop until your next alert. Your light will continue to flash for another 10 seconds, reminding you which box to take. The easy-to-remove boxes have an extra-large capacity. Your box has been designed with special finger tabs for easy opening and internal angling for easy scooping and pouring. Where can such a small investment in yourself have such a huge impact on your health and well-being? Quite simply, MedQ remembers, so you don't have to.
At this point, I'm feeling pretty good about that paper that I had to write. I was thinking, this is great. I have 4 ways that occupational therapists can help with medication management. So I had introduced the topic, I had our distinct roles, and all I had left to do was find evidence-based practice. Well, I could not find any recent articles that were evidence-based that showed support for occupational therapists being involved in medication management. I was speechless. I went running into my professor's office and I was like, I can only find one article. What am I going to do? If we were able to be together today, you'd probably see the distressed look on my face. My professors always have this open door policy, which I am sure when I graduate, they are going to get rid of because I am always in their offices. But I remember my professor saying that this was a topic that did not have a ton of research on it. And I was confused on why. And I was really confused because I had just learned about all these medication statistics. Let's go over some. 50% of people do not take their medication as prescribed. And 80% of older adults take at least one medication a day. The reason why we take medication is so that we can treat health conditions. So what happens when we or older adults don't take our medication? It can cause disease to advance, decrease quality of life, increase hospitalizations, and cause a premature death. If medication adherence is not followed, this can cause a safety implication for the client. This is relevant to occupational therapy since safety is considered an instrumental activity of daily living. As you can see here, it is an occupational therapist's job to make sure that the client is able to maintain a safe environment in order to reduce the threat to health and safety. There is limited research that states that occupational therapy should be a part of medication management. Occupational therapy should be involved within medication management since it is a part of clients' function and safety. Nowadays, doctors are scheduling patients every 15 minutes. This is not enough time for them to educate clients on their medication management. This is where occupational therapy can play a role to make sure that medication management does not negatively affect a client's occupational performance. Over the course of these years, while we are in school, we are trained to address these issues that are related to medication management. It is time that doctors, physician's assistants, and nurse practitioners realize how OT can help our clients. Together, we can ensure that older adults can live fulfilling lives without the side effects of disease. I want to take some time and thank a few people. First, I want to thank our director, Melissa Kaplan. I also want to thank all of my professors. As I have said, I'm always in their offices. I want to thank my family and friends who have always believed in me. I couldn't have gotten here without them. Congratulations, class of 2020. We did it.